Hello friends, let us now learn some important questions. During separation, sexual intercourse between husband and wife is only a crime if complained by a victim. It is only a crime if complained by victim, and minimum punishment is 2 years. Minimum punishment is 2 years. So during separation, sexual intercourse between husband and wife is only a crime if complained by a victim, and if minimum punishment is for 2 years, only then it is a crime. Next question: which of the following is true about euthanasia? Next question: which of the following is true about euthanasia? Passive euthanasia now allowed in India but with some conditions. True. Passive euthanasia is allowed in some states of United States. True. Active euthanasia is withholding life support by a doctor. No, actually this is passive euthanasia, whereas active euthanasia is you will give drugs to kill the patient. Okay. Next, passive euthanasia is allowed in Belgium and Netherlands. Yes. Okay, passive euthanasia is allowed in Netherlands, Belgium, and even Switzerland, United States, Luxembourg. In those areas, passive euthanasia is allowed. Then, early onset of rigor mortis is seen in tuberculosis and cholera. We see early onset of rigor mortis. It is seen in tuberculosis, cholera, typhoid. Then cancers, we will see early onset of rigor mortis. Then next question: all of the following are true about organophosphorus poisoning except atropinization is adequate or not, can be judged by dilatation of pupil. True. Atropinization is adequate or not, can be judged by dryness of mouth. Both these are true. Decreased secretions of the salivary gland. Yes. Atropine is associated with decreased secretions of it's not atropine. Right. It organophosphorus poisoning, there is increased secretions of salivary gland, and that is the reason when you give atropine, you will have to see whether there is decreased secretion of salivary gland. That is checked by dryness of mouth. Seizures are controlled by phenytoin. True. If there is any anxiety, that is decreased by diazepam. True. Pinpoint pupil is not seen in. Pinpoint pupil is actually seen in opium, cannabis, not in cannabis, organophosphorus poisoning. Opium and organophosphorus poisoning, we see pinpoint pupil. Aconite, there is alteration. In aconite, you will see pinpoint pupil and then dilated pupil. That contract and dilatation of pupil seen is called as hippus. That contraction and dilatation of pupil which you see in aconite is hippus. Then in alcoholism you see dilated pupil, and in cannabis poisoning also you see dilated pupil. Thank you for watching.